Together with Doctors of BC and BC Family Doctors, we've developed a new patient model and have a new tentative physician master agreement. This payment model for family doctors will help protect and strengthen BC's healthcare system by helping to attract new family doctors and retain existing doctors. By supporting our healthcare workers, including doctors, we are helping patients get better access to the healthcare that they need. And that's what matters most, making sure patients get access to that care. This new payment model, which will be available to family doctors beginning February 1st, 2023, provides another option for family doctors that makes a departure from the fee-for-service model, under which doctors are paid primarily on the number of patients they see in a day. This brand new model takes into account 5 factors, including the time a doctor spends with a patient, the number of patients a doctor sees in a day, the number of patients a doctor supports through their office, the complexity of the issues a patient is facing, and administrative costs currently paid directly by family doctors. It will give family doctors a more equitable payment option, one that better recognizes their value in providing primary care, full-service care to patients. Importantly, it will help maintain their business autonomy, giving them more flexibility to create the kind of practice that works for them and, most importantly, for their patients. With respect to the tentative physician master agreement, I'm happy to announce that the province and the Doctors of BC have reached a tentative physician master agreement. This agreement includes several commitments that will better support doctors as they care for patients. It also reflects the desire and commitment of the Doctors of BC, the Government of BC, and BC health authorities, working together in the interests of patients. The tentative agreement fosters stronger collaboration and reduces the barriers to doctors in the delivery of care to their patients. The tentative agreement supports our continued collaboration on key priorities to improve healthcare, including gender equity, reconciliation with Indigenous people, and workplace safety. The tentative agreement we've reached addresses work doctors complete after regular operating hours by addressing improvements to existing alternative physician payment contracts and increases. Improving and increasing access to health services for patients will continue to be the focus of Doctors of BC and the Ministry of Health working groups over the coming months. This includes how to best attach patients with complex needs, a provincial rostering system to ensure patient care continuity, a provincial patient survey, and how best to incorporate into the new model other services that family doctors provide outside of clinics. This is all part of refocusing and our continuing efforts to develop and improve our primary care strategy.
The new physician master agreement that will be going to our members for a vote in the next few weeks. It is by far the best agreement negotiated for physicians in Canada this year, and I believe it is one of the best that has ever been negotiated here in BC. It allows us to target funding to areas that need it most, so that we can ensure physicians, both family doctors and specialists, are recruited and can stay in their communities and also have the tools and resources to provide the level of care to their patients. On a personal note, I'm particularly proud of the commitment within the agreement to address gender equity across the profession and to integrate cultural safety and humility into all of our work. Our new family physician model, co-developed by Doctors of BC, BC Family Doctors, and the provincial government, represents a seismic shift in the way we practice in BC. It is a model unique in Canada, bringing together the best of a range of payment models. It addresses rising business costs. It recognizes the value physicians provide when delivering longitudinal care, and it will compensate us for the time spent on evening and weekend administrative burdens. Our hope is that this new payment model will not only stabilize longitudinal family practice, but help make it both sustainable and rewarding. Everyone deserves a family doctor, and this new option is a significant step to help make that goal a reality.